Hello, my name is Marco Rudos, and I would like to talk about health disparities, and specifically healthcare access and quality for the Latino population here in Salt Lake City, Utah. According to Healthy Salt Lake, there is about 250,000 individuals who are Latinos, and they compose about 20% of the population. The Latino community is made up of diverse individuals, often set apart by their country of origin or ancestral history. Those individuals here in Salt Lake sometimes a lack of health insurance or healthcare access. Um, there's different reasons why. We're gonna go over them and then see what the government is doing to help or the community, and also what else we can do, and specific as a future mental health nurse practitioner, what I can do to help that population, my population. Uh, the issue starts with again they don't have insurance. According to a report done in 2021, uh, due to health status by race and ethnicity, it shows that about 36% of Latinos don't have insurance. Also, about 43% of Latinos don't have a primary care provider. We can see how this can affect the physical health and also the mental health. Um, and just to have an idea, women who are Latino, they compose about 15% of postpartum women, postpartum depression. There's also adolescents with suicidal ideation, and the Latinos made up about 50%, 20% of those populations. Also, binge drinking, about 13%. So we can see how the community is suffering from lack of healthcare. And the Latinos are also immigrants, so we have to have that in consideration and how that will affect them. Um, some of them are born here, but they still have the idea from their parents, grandparents, and the culture in which they grew up. It can affect how they seek healthcare um, or how they see mental health. One is the attitude. Latinos, they have a lot of religion backgrounds, and for that point, many believe that mental health it's not having faith or that you're possessed by demons. Especially when talking about schizophrenia or people who have psychotic episode, hallucinations, delusions. Um, and sometimes they don't want to tell their family members due to that, how their view and the stigma there is mental health among the Latino population. Um, and that goes along with how they don't seek treatment until the very end when they are really sick and they had to go to the emergency room. Another issue is prevalence. So among the Latinos, the older adults and youth are more susceptible to mental distress relating to immigration and acculturation. Um, so the other Latinos had to leave their house in their origin, country of origin, due to persecution, crime, terrorism. Um, and many times this leaves a person with anxiety, depression, PTSD, and those issues are not addressed. So they pass it on to their family members, their children. So we can see how this affect that adolescents population, especially if their parents also, because of the socioeconomic status, they had to work more than one job, and there is no parent in the house to take care of the children at time, and they are living with family members or um, in the childcare places. And also, we can notice that there is research that shows that um, being raised in childcare can lead up to 30% of individuals in the future to end up in jail, suffering from a mental health problem too. Um, and the treatment issues. Many people here in the Latino community, they don't speak English. They rather speak Spanish or they can get by. My own grandmother, who lived here for over 40 years, She only speaks really basic English. Um, so I can notice how that can be possible. Um, Also, the many Latinos don't have a healthcare provider who speaks Spanish, or they feel more comfortable with someone who's Latino too. Because especially in mental health, when you try to really dig deep and tell important things that are really personal, they really don't have a third party to express themselves, um, and we can see how that can be compromising for them, and they restrict themselves from going to a mental health provider. Um, so this leads to adolescents and having issues with depression, anxiety. In children, this also can lead to ADHD, um, and the access of insurance. So many people don't rather pay other bills that they need to support their family than healthcare. And Latinos don't see the importance of that because it's not a problem that is in front of them right now. It's something that they have to deal with it in the future. And that's part of the culture too. Lack of cultural competence um, with them, how the system works here, and how preventive care, and also how providers don't see how the Latino population really works, or the problems that they had to go through. Sometimes they live in places where there's crime, or they had to get by, day by day. So sometimes they're misdiagnosed because of how they talk, how they act. Even within the language, sometimes their language has different meanings. So that provider misinterprets what they're saying and giving the wrong diagnosis. Therefore, that's also disparity. The legal status is a problem too sometimes because of the legal status. They don't seek providers. They don't talk about the issues that go with that, especially in mental health. Even though that um, there's laws that help them, they don't know that. So there is also misinformation that goes along with that. Um, and how can we improve, right? Well, the governor, Gary Herbert, he tried to implement task forces. Some of them is a multicultural council association that tries to represent the Latino population in Capitol Hill. But at times, that's no, it's not working that well, as Latinos don't express themselves. That is mostly youth that try to express what their parents are going, but they're going through a lot of things themselves. So there's other people who try to help and try to provide their own way of helping. Their association, which is a Multicultural Council Center, which it was founded in 2015 by Carla Arroyo, and she's a licensed social worker who's a therapist and works with Latino individuals. She also tries to help more in immigration and legal status and all of the other things. So among those task forces that were done, what else can we do, right? So I propose that one of the things we can do is acculturation, more than just saying how it works, that we can provide Latino providers by helping with scholarships, with grants, so that way there's more Latinos who can help other Latinos too in this population. Another thing is education. We need to educate the Latin community about what to expect, what things go through during the mental health, and how it works. Because sometimes they're afraid of medications or other things. We can teach them that therapy can be a way to help them too. Among that, we need to help our population, just because, kind of, as Jason Lyle said, one person struggles, we all struggle. One person triumphs, we all triumph. And among our populations, the Latino population contributes a lot in a social aspect and economic aspect of this community, and it will be important to help us, the Latinos, to another Latinos. And thank you for your time.